With many pharmacies planning to make the vaccine available to the public once supplies increase, it's important to recognize high-priority groups that will receive their vaccines first. States have responded differently to the push for expanded eligibility, and this has created confusion and frustration in some areas. Out of necessity, some states have stuck to vaccinating only healthcare workers and long-term care residents, while others are trying to accommodate the expanding list of priority groups. Today, we explain how it may be possible to receive the COVID-19 vaccination near you, even with the high demand. If you haven't already, check our videos on vaccination cards and the vaccine components that will add more insight into what you can expect on the vaccination date. The link will be in the description. As we await emergency authorization of more vaccines to help alleviate limited initial supply, 60% of U.S. pharmacies are preparing or starting to administer the COVID-19 vaccine, but they're also planning for when supply begins catching up with demand and more people gain access to COVID-19 vaccines throughout their stores. This is happening as the White House started shipping vaccines directly to pharmacies, and as some states scramble to vaccinate anyone 65 and older to get more people protected faster. Federal health officials in early January began urging states not to stick too tightly to CDC's priority recommendations. State public health departments can adapt and set their own guidelines to match their population's needs by getting people vaccinated rather than perfectly helping through each prioritized group. New York is letting people in certain groups make appointments through the Department of Health eligibility portal, including the following: people age 65 and older, teachers, childcare providers, restaurant workers, transit workers, police, and firefighters. It could take 14 weeks just to inoculate all New York residents aged 75 and older, an estimated 1.4 million people. A network of pharmacies in the state, starting with 500 and going to 1,200, is expected to vaccinate the bulk of people 75 and older. For the next few weeks, the federal government will ship states a minimum of 10.5 million vaccine doses per week, up from 10 million. This will give states the ability to accurately predict their supply and ensure that pharmacies have the infrastructure and the experience to scale up when vaccine supply increases in the months ahead. The move is also meant to address vaccine equity and help those who are most socially vulnerable during COVID-19. Consumers are advised to make sure they're eligible for the vaccine and to check pharmacy websites often to see if they can get an appointment. For the bulk of us who may not be regarded as first priority, locations that will offer shots on February 11th will allow people to sign up for appointments starting February 9 at CVS. They can book both initial and booster doses at the same time through the CVS Pharmacy app, on CVS.com, or through the toll-free customer service phone number. Patients will receive a mandated vaccine card and follow-up reminders between vaccine appointments. CVS is prepared to offer the COVID-19 vaccine in all 50 states. Walgreens expects to have vaccines available to offer the general public at its 9,000 stores sometime in spring 2021. Health officials are exploring different avenues, such as mobile health clinics and community health centers, to distribute vaccines to rural, low-income, and hard-to-reach populations. For those of us remotely at home, it may be difficult to be patient until then, but we hope everyone continues to be morally responsible and safe. Thank you for following along.